All right, looks like the majority of people have been able to log in. So first of all, welcome. I hope everyone's doing well on the call today. Thank you for joining us. Start by introducing myself. My name is Omar Salame. I am the Chief Client and Product Officer here at Bonfire. So my team is responsible for working with procurement teams across North America and bringing their procurement process online. And before we begin, I thought we'd cover just some housekeeping items. If you have a question during the webinar today, please feel free to use the Q&A section in the GoToWebinar panel that you see. Type those questions in. We will try to leave some time aside towards the end today to kind of dig through those. We have a packed session for you today. Thanks for those who sent in questions when they registered. We will be tackling some of these questions as well as cover other insights with our panelists. So today I'm joined by a diverse panel of procurement professionals from across the States and Canada, each bringing their own expertise and valuable lessons learned from how they dealt with working from home and also with procuring emergency supplies for their citizens and members. Today I'm joined by Paul Brennan, who has more than 25 years of experience in public sector procurement. He has been actively involved in promoting public procurement and educating public procurement practitioners throughout his career. Paul currently serves as the Director of Purchasing for the County of Rockland and also is the President of ProcurePath, a training firm dedicated to training public procurement professionals. I credit Paul in seeding the idea for this webinar, actually, particularly when I saw his LinkedIn post searching for emergency suppliers for his county. Thanks for joining us, Paul. Also joining us. Thank you, Paul. Also joining us today is Joel Neville, the Director of Procurement at Louisville Metro Government in Louisville, Kentucky. Joel and his team are responsible for the management of over 1,100 contracts that assist in the programmatic and operational functions of the city. We've been working with Joel for years now, and one thing that always stood out to me about Joel is his innovative approach to procurement and his refusal of the "we've always done it this way" mantra. We're glad to have you on the call with us today, Joel. We also have Travis Temayer on the line today. Travis has worked at Eastern Michigan University for 15 years, starting out in the facilities department. There, he managed construction projects, negotiated contracts, and assisted departments with facilities needs. In 2010, Travis moved to the purchasing department and became director in 2017. With a focus on the need of the end user, not just the price, Travis has led campus projects to consolidate business practices to assist in modernizing procurement processes at the university. We're glad to have Travis on the panel today, especially given his experience on the facilities side and the interest from attendees in managing construction projects during COVID. Thanks for joining us, Travis. Last but not least, we're joined by Jay Ayers. Jay has over 40 years experience in supply chain management, with the last 25 years focused solely on capital equipment and nutrition group purchasing. He has been the director of St. Joseph's Health System Group Purchasing Organization since 1992, a role in which he oversees the ongoing development and implementation of both capital and nutrition procurement programs. Jay and his team are credited with guiding us in the development of some of our marquee features at Bonfire. His team leads procurement activities for over 400 hospitals across Canada, a process that his team manages almost entirely remotely. Needless to say, he knows a thing or two about medical equipment and supplies. Again, thank you for joining us today, Jay. Now, for today's agenda, again, looking at the questions that had come in from the registrants, we thought we'd focus on these three major themes that you're seeing on the screen today. First theme is focused on procurement of emergency supplies. We're then going to shift to talking about working remotely and how to handle your procurement process when you're away from the office. And finally, we're going to discuss vendors and how COVID has affected them. Time depending, we'll dig through some of the questions that have been submitted throughout the webinar today. So focusing initially on emergency supplies, The first question we're going to ask is going to be directed towards Travis and then Joel. How have you reprioritized your spending given COVID? Have you refocused on running mostly emergency procurement? Maybe start with Travis.
I would say reprioritizing of spending is. I'm getting a lot of feedback from someone. Maybe I think it's from Paul. If he could mute his microphone.
How about now, Travis?
Okay. Yes. Thank you. So we have reprioritized some spending, mostly. I wouldn't say emergency procurements. We've been kind of working with our departments, our academic departments, to change the delivery method of those procurements. We have some existing contracts that our facilities department we've established over the last 3 to 4 years that have helped us have some more strategic suppliers, and that's helped us get through some of the challenges of the supply chain. We've had some regular meetings with them, but we've really cut back on our spending. I've been in meetings with our CFO, our business and finance team. We're really trying to get departments to limit spending as much as possible, just because of the budgetary aspects at a university with the students shift and the unknown going forward process of how are students going to come back to campus over the next few months.
Thanks, Travis. Joel, do you have any additional commentary on
that? Yes. So I would say that reprioritizing spending is a step that we've taken, but it's not really about prioritizing. It is the fact that everything is a priority. And unlike academia or other private institutions, the role of our government is to make sure that we're there to ensure the safety and the health and welfare of our citizens. And so if there's ever an emergency, and this certainly does qualify as one, the governor and the mayor will issue an executive order that authorizes us to do away with certain formalities in the procurement process. And so there's a reason why we have a rainy day fund. We don't want to just expend funds on things that are unnecessary, but the emergency is the priority. We take care of those things first. So that's the role of, from our perspective, as we see in government, is take care of the emergency while it's occurring, but just roll back any unnecessary spending that we know that it's going to have a broad impact on the operation of the government in the future.
Thanks, gentlemen. And here we have actually a pretty diverse set of registrants today that span municipal, healthcare, academia, K-12. So it'd be interesting to see the contrast between different organizations, how they were able to respond to this. The next question is directed to Paul. And again, I saw this LinkedIn post early on, Paul, when the county was probably going a very rough time procuring emergency supplies. And I know you've actually had a lot of experience doing this before and now more recently, but what advice do you have for teams procuring emergency supplies, maybe for the first time? And what was your team's approach of procuring emergency supplies during COVID?
Well, we learned from our experience in dealing with other emergencies, such as hurricanes and so forth, that we really needed to break down the needs into smaller baskets and assign specific individuals to be responsible for certain needs. The big need, of course, in this emergency is all the personal protective equipment. So I basically took my staff and broke them down of having one person responsible for masks, one person responsible for isolation gowns and things of that nature, another person responsible for hand sanitizer, and so forth. And that way I had specific people that were out there all day. It's really been a 6-day-a-week job, chasing down these medical supplies during the national shortage. But breaking it down and having specific people working together. And communication also is very important. We are working remotely. However, we do have at least one daily conference call a day to kind of recap, because it's very important that the buyers share information. Well, one buyer may be tasked with going out and finding masks. They may be speaking to a supplier that has hand sanitizer available, or some of the other supplies that we're looking for. So it's important that we share information on a regular basis.
Thanks, Paul. So the takeaways is they're specializing or assigning team members to specific needs and having constant communication throughout. I'm going to turn this, maybe a follow-up question for Jay. Are there any tips you have for those who are buying PPEs or other medical equipment for the first time?
Yeah, I think there's a number of issues that we address. Number one is when it's an emergency state, some of the rules go out the window. You need to be aware of what your main rules are. And, you know, we have Health Canada approval. In the US, they have different approvals that must be maintained. But barring that, how you find equipment and PPE, you use what is available to you to find it. Means you never used before, including Google. Google was key for us. We found 4 pillars for success, actually. Communication was key, cooperation. We needed to work together with other groups, collaboration and creativity. In Ontario, in Canada, we went at this from a provincial standpoint, and they formed teams. They utilized all the SSO groups and all of the GPOs, and we utilized our experts in each of those areas, and we worked together on behalf of the province. And so they centralized it at the top, and all the information went up. And as the needs were identified, they came back down to us. Another thing we found on the equipment side is when there is an emergency and a need, the first question isn't what product do you need? The first question is, what's the problem we're trying to solve? And that made a big difference on how people thought and how they approached things. When long-term care started to have their major issues, a lot of long-term care has moved to a socialized environment for breakfast, lunch, dinner, and snacks, where that's your family, actually, and you interact. But when you're in the middle of COVID-19, that doesn't work anymore. We need to keep people spread, you know, the 6 meters apart or 6 feet apart. And so all of a sudden there was this enormous need for overbed tables. And we saw orders from one organization for 5,000. Well, that just took everything out of the industry. So in order to supplement the need, it wasn't overbed tables, they weren't available. It's what else could we use, right down to the old TV tables that we used to have. So when you go into this, there's process, but then there's also, you need to define what will work in the interim while you come up with what you really want to supplement with.
Thanks, Jay. That's a key part. We're targeting a specific need, which is separation, being able to eat while in bed. And, you know, while the natural response would be just to get that exact piece of equipment, you're basically suggesting we can be creative sometimes as well in terms of satisfying those needs. Joel, do you have anything to add on this as well?
Yes, I like Jay's perspective. Obviously, things are a little bit different here in the States, and obviously there's been challenges in terms of sourcing PPE at the federal, state, and local levels. And from a local government perspective, we saw really a lack of preparedness and our dependency on just-in-time delivery. And so the cooperation kind of breaks down when there isn't clear communication and available supplies. And so we have been doing unconventional methods of procuring PPE, and it really comes down to where were your relationships prior to, and how can you leverage those relationships to get closer to the manufacturer of those supplies. So everybody from the highest governmental politicians and lawmakers to economic development, everybody wants to help and everybody has a guy and a recommendation, and you do have to find a way to vet all those leads, but most of them come to dead ends. So it's really working on those, utilizing the solid relationships that were established prior to this emergent situation to really try to get to the source of that manufacturing. That was key for us.
Thanks so much for the insight, Joel. I didn't mention this earlier, actually, but we're going to be engaging the attendees today with some poll questions as we go through the webinar today. And the first one is actually going to be launched in a bit to set up our next section, which is focusing on working from home. A lot of questions came in from registrants specifically on that. And so I'm going to be launching a question in just a bit, but just let me show you quickly what it is here. The purpose of this question is to get a sense of, how many of us on the call today are having to deal with working from home and remotely. So we have just launched the poll, or be launching in a quick second. We'll maybe give everyone maybe 15, 20 seconds to respond. And again, that will inform the next section of the webinar today. Okay, so lots of submissions coming in, and the poll's still in progress. Maybe we'll give, yeah, go ahead.
Omar, it's Jay. Just another point on the emergency supply scenario. When you're in this situation and the panic sets in and the calls start coming in, one of the things we made sure that we did was we utilized Bonfire. So we knew coming down the line, if we were going to have to start setting up hospitals above and beyond what we had available to us, that there was going to be a need for equipment. And we got from up above some indications of what they thought they might need. And then based on some of the other items that we were used to seeing utilized in these situations, we had to go out and acquire information for portable radiology and for pumps and items like that. And because we have Bonfire in place, what we were able to do was take our old RFPs, which were really quite recent, and take the information from those RFPs, from those submissions, of which, when it comes down to radiology and pumps and that, there was like 17 vendors that we could pull the information from. And we garnered that information and the breakdowns and everything associated with it, including, lead times, including pricing, warranty, service, training. Could they do training off-site virtually if it was a new vendor for an organization? And we were able to put that all into a spreadsheet. And then we put a cover letter on it stating to the vendors that this is information we garnered from you in a recent RFP. It is considered private, and we have enough trust with all the vendors that they were very cooperative with us. But rather than having them start from scratch to determine what they would put on a portable DR or a portable C-arm or portable radiology unit or portable ultrasound, we gave them everything back that they gave to us in a spreadsheet, and then confirmed their permission to proceed, and then asked if there was any changes based on, we're talking a provincial scenario in an emergency, we're not going to buy 2, maybe we're going to buy 5,000 of them, what kind of impact that will have. And they were very easily able to fill in our spreadsheet, send it back, give us permission to proceed with the updated information. And what would have taken weeks for them to do, they were able to give back in a day, and then we were able to forward that information on to the people. So you utilize the tools around you to make it easier for the vendor community, ask their permission to be able to do it appropriately, and then go from there. So that was just another technique that we used, and we utilized Bonfire to do it because we have all our history there. And the responses from the vendors, one, they appreciated that we did it that way because they were just way too busy with all of the incoming questions that they were getting, and they were able to respond quickly. So that was another key point.
That's actually a great idea, Jay, and we've never thought of that myself, but we know historically, as you know as well, everybody on the call, suppliers take a long time to craft those responses, and you're just basically cutting that time for them to be able to quickly cut your procurement cycle length. Paul, I think you also have an additional comment you wanted to make on this.
Yeah, actually, too. One of the things I did find, you had mentioned it earlier. I found social media to be very helpful. So going out on LinkedIn helped provide a lot of leads to us for supplies. So it's one of the new tools that are out there. Don't be afraid to go out to your social media network to use that. And the other item was that you need to be prepared to work with your other agencies. Because what we found, the minimum order quantities in the very beginning of this crisis were so high, much higher than our organization would normally need. So we had to start speaking with and partnering with surrounding counties in regards to some purchases.
Thank you so much for that insight, Paul. So collaborating with others to make sure that the demand is there. I have one additional comment, I think, from Travis, and then I'll stop the poll and show you the results.
Yeah, so one of the challenges we've had too, because university, we have so many different types of departments. We recently had a meeting with all of the departments that really are procuring PPE on their own. And one of the things we found is, we're not tapping into from one department into vendors that are really available. We've been trying to do similar things with regards to streamlining our procurement process, but we're trying to pull those different areas together, and then hopefully that will help us to maximize the use of those products, because we have our skeleton crew on campus, but they all need the same type of equipment. So hopefully we're just getting that process started, but it seems like it's going to work out pretty well for us to maximize the use and procurement of those particular items.
Thanks, Travis. So similar vein to what Paul mentioned at the county level, but even departmentally across the same university, you're finding the same pattern as well, of having to consolidate the spend and the effort basically to get those PPEs. Thanks everyone for the commentary. I know this poll has been launched for a while now. Let me show you what the results are, because actually they're very telling in terms of the next section. So 77% of attendees today have been consistently working from home for the past several weeks, and very few have actually had business as usual. And so I hope this next session will be very valuable for everyone. So on that note, let's switch gears here and look at working remotely as a theme here. And I would say the number one type of question that we got relates to this idea of running a type of meeting remotely now, as opposed to just kind of having access to your office. So the first question is directed towards Paul and Jay. How are you running your meetings, such as pre-bid meetings, bid openings, managing site visits nowadays? Maybe we'll start with Paul.
In the very beginning, we postponed a few pre-bid meetings, not really knowing how long this was going to go on for, but quickly realized we were going to have to come up with some new procedures, that the old way of doing business wasn't going to keep us moving in the right direction. So we're currently using WebEx for pre-bid meetings, as well as bid openings. We're recording the bid openings and providing them to anyone that responded to the solicitation. And we're in the process of making a section on our website where we'll have all the bid openings available if someone wants to log on and to view and listen to the bid opening. In terms of managing site visits, we have gone ahead with a couple of them because they were really, the contract required that you have a site visit. So we made sure that we planned ahead, knew how many people were coming, make sure that social distancing was adhered to, and tried to make the meetings as short and quick as possible. But we find that in certain instances, you're still going to have a site visit or a walkthrough, and you're going to have to adjust the way you do that.
Thank you, Paul. Jay, anything to add to that?
Yeah, I guess we're a little bit different in many ways because we are in healthcare. The RFPs that we had in process were based on, and because we deal in equipment, people need the equipment. We need to finish the RFP process. The COVID-19 situation basically shut a lot of our processes down. So what we've been working on is how do we get back up and start to move forward again. I can share some things that we've tried and have been successful with you. In regards to bidders meetings, pre-issue conferences, we've always done those online. We'll post it to the world. We'll have as many as 100 different individuals online from various organizations, and they will see the entire process of how the RFP is going to run, timelines, who's involved, what's being bought. We also have the hospitals join those and invite anybody from the hospital that wants to, because as you know, there is a working committee from each of the hospitals in the process. But there are a lot of people in behind, like techs and doctors and VPs of finance and all of those who know what's going on, but are actually wondering, you know, how's this all going to play out? So they're all invited also to the presentation, and they get firsthand knowledge then of everything that's about to occur over the next 8 months. And we found that has cut back an awful lot of resistance going forward as we go through the process, because now you have everybody with the knowledge of what's going on and who to talk to if they have any questions as things start to pan out. In regards to bid openings, so nothing has really changed for us in that regard from the pandemic standpoint. In regards to bid openings, we've never done public tender openings. We don't work that way. What we use is Bonfire with the submissions, and once they're received and are ready to, or the RFP is closed, then our team reviews all the mandatories, and if everything is in place, then we distribute through Bonfire to all of the hospitals for their evaluations. So that really hasn't changed too much either. Based on the bid openings, we don't do that part. Now, the managing of the site visits has been very key for us. That's been an integral part of what we do. When you come to putting in $1 million pieces of equipment, you could have $1.5 million construction bills that have to go along with it. So they're very, very key and integral to the process. What we have implemented now is, and we've been working with both the hospitals and the vendor community, is to do these in a virtual process. With we have a hospital that had to proceed. COVID-19 could not stop the process for a hospital who has to replace a very key piece of radiology equipment. So we had to start in the middle of all of this, a new RFP for those folks. Working with them in the vendor community, what we have done is put as much information in the RFP when we release it in regards to drawings and technical information and everything that we can possibly give the vendor community. And then we'll be holding a virtual meeting with them. We always from the hospital have plant operations, techs, engineers, technologists, everybody who needs to be there will still be there. It'll be mandatory, and all of the vendor participants will have to sign in and prove that they were there. And we'll be able to virtually take them through everything that needs to be done and the Q&A. So that will allow that part of the process to move forward. In regards to after vendors make their top 3 vendors of choice, then they generally would go on a site visit. If you're going to buy a multi-million-dollar MRI, you want to go see, touch, and feel, which has always been a major part of our process. You can read 250,000 words, but it doesn't get put into context till you can touch, feel, and see. So we just completed a virtual site visit. The hospital was in Ontario, the vendor was in Europe, and the feedback that just came back today is the application specialist was able to demonstrate all the requested functionalities, was able to repeat procedures and zoom in on features at the request of the clinical team. They were able to live do Q&A, and at the end of the day, the clinical team at the hospital was so pleased with the results that they definitely considered doing this in the future. And where that plays a major role is we have physicians involved, and taking a physician out of Ontario, putting them on a plane, taking them to Europe or other countries for 2 or 3 days just doesn't pan out very well. Whereas under those situations, if we can't get them out, they'll be able to just sit down at the computer for the day and be able to go through the process. So that was a proof of a major success. We have 3 other hospitals right now one out of the Yukon, which is the west coast of Canada, and 2 more in Ontario who will be proceeding from the virtual standpoint and with the virtual turnkey. So that appears that the vendors are warming up to it. It will be a major change, but that's what materials management is, right? We are the agents of change. So this site visit on a virtual standpoint may very well play out as we continue to move forward. And then for us on the negotiation side, we have always done negotiations virtually. Our process, which has been in place for years now, is understood by all of our members and is understood by the vendor community. And what used to take us 3 months and thousands of dollars in legal bills, we can now, historically now, negotiate in a day. And we now, because of, we have a lot of members on the East Coast, on many times we, not under COVID situations, still do it virtually. We still do it online, and we have the vendors situated in various places so that everything is efficient. So that's how we've been working this and trying to move forward more from a virtual standpoint.
Thanks, Jay. And it shows that if we're able to buy multi-million-dollar equipment with associated multi-million-dollar construction, retrofits to do this, then I guess hopefully it'll give more confidence to the attendees today that you can probably do the same with your organization. Maybe as a sub point to this, another question that or subset of questions that we got from the registrants were related to construction projects specifically. And this is going to Joel and maybe other panelists if you'd like to comment on it. But do you have any advice, Joel, for teams running their public works and construction opportunities online for the first time during COVID? Joel, I'm not sure if can you hear me okay?
I'm sorry, I had on mute. I was just going to say it's pretty much just replicate whatever Jay said. I think you can apply some of those principles back to construction and public works projects. But the main point is that from a public procurement perspective, we just want to make sure the process is fair and equitable to all parties, and keeping that in mind from put yourself in the contractor's position. What is fair in this new day and age? So advice is to, from a more systems perspective, really assess whether or not, we always say, oh, site visits are required. Are they really? Should we reassess whether or not they are required? Not always. It's just because we've always done it that way. Really dive in and see what policies are necessary. Is that just something that we've created because of the circumstance? So I would just say, Jay explained great harnessing technologies and utilizing Bonfire to help implement those technologies and selection processes. But I would just say, reassess from a systems point of view what is required either by your law. If it's a policy, see how you can adapt or modify those policies to really make sure that it's fair and equitable to all the contractors.
Thanks, Joel.
Yeah, Omar.
Yeah, go ahead.
Joel made a really, really important point there, and I agree with him wholeheartedly, and that's the fact that everything has to be fair and transparent. Vendors don't like to lose, and I don't blame them, but they're willing to lose if they believe it was fair and transparent. And I think one of the reasons we make our meetings mandatory and we make them all come together, and why it was so key for us to find what is now this virtual scenario, is that everybody must always hear the same thing at the same time. If other vendors ask a question, then the answer that they get should all be heard and answered in front of everybody else. And now everybody is kept on a level playing field, and that's what our goal has always been. And so that's where the scenario of virtual has come in, and making everybody still be there during turnkeys scenarios like that. And it works. Nobody likes to lose, but if they believe it's fair and transparent, they're going to accept it a lot better.
Thanks for that, Jay. And actually related to this, I'm going to be launching another poll on how have you adjusted your process, especially given that 77% of people on the call today are working from home. And so the question, you'll see it here pop open in a bit, but how have you adjusted your process to run virtual processes, meetings, whether there's consensus, bid opening, or et cetera. And we're just trying to get a signal for, have you adjusted things already? Are you planning to? Have you not? And then we'll share the responses with the panelists, and then we'll go on with the next set of questions for working remotely. I'll probably keep it open for maybe 10 more seconds and trying to give a chance for everybody to respond. All right, so we have close to 50% of people who have voted already. So we'll close it maybe as we hit 50% and just reveal the results for everybody. Okay, there we go. And it's just waiting to share the results here. The majority, 70%, have actually started to adjust the process and run maybe virtual meetings. And the next biggest one is, the change is going to happen, but hasn't happened yet. So we're looking at the majority of the audience today kind of agree with the panelists in that we have to look at things differently and utilize different tools, perhaps, and processes to do so. And we'll dig into that in a future poll and some additional questions. So moving over to the next one here. This is a question for Travis. What internal control systems have you incorporated to accommodate process changes, whether we've talked about earlier today or maybe different process changes that you've had to make?
So we've gone to with probably two of our main suppliers. We've instituted some more controls to help kind of give visibility to needing to ship items to faculty members' homes, staff members' homes. One of the challenges, obviously, if we don't give visibility, they can order a lot of stuff and we would never ever know what they're keeping personally. So we have gone to a case-by-case basis. Our standard process is everything still ships to the university. We instituted all shipments from our two main suppliers for staff supplies. Those all go to the central receiving office, which I manage, and then they have to schedule an appointment to pick up those supplies. For academics, we have gone to an approval process from their department head and myself to get those shipped to students that need them. That seems to be working pretty well. It has shut down a lot of, I would say, extra buying of supplies that we may have used on campus, but we've been trying for years to get people to stop buying just because they're not there. They don't necessarily feel that they need them. So that's worked out very well. We've also gone to, with regards to like construction projects, we've totally gone all online with that. We haven't had a public bid opening in, I don't know, 5 years, I think. We don't do that anymore, but we've pretty much gone to everything being remote through some sort of video conference. Our negotiations the same way, and that's just to try to keep everything equitable. We do have a current RFP out that normally I would have made a mandatory meeting. However, we allowed that to not happen just because the vendors that we're engaging are dealing with a lot of the same remote work issues and finding the right people. And so we ended up changing a process where we're recording those virtual meetings and posting them within the bid to allow viewing. And so I think but we're still investigating some process changes coming up that we may institute to help control spend, to help control product buy, just to get us through the next 6 to 9 months more effectively.
Thank you, Travis. And we're going to be staying within the same theme here. This question is directed to Joel. Now that your team is remote, how have you changed the scope of your team member roles?
I would say, and if you ask them, I would say their roles haven't changed much. We've really been relying on, so in relation to the response to the emergency, we have one buyer in particular who generally takes care of the public safety departments, and she's been working a little bit over and above, working to help facilitate procurements related to the emergency. However, we've enabled our staff members and equipped them with the tools necessary to continue their work as if it's continuing without any just standard operating procedures. So they have, everybody has laptops, everybody has connectivity. We've gone to DocuSign for all of our electronic document requirements. Everybody's got WebEx so they can host online meetings and such. So we've pretty much, and of course the Bonfire platform, adopting that early on really provided us that ability to flip on a switch. I think our emergency was declared in March 3rd or the week after, and 2 days after we were discussing remote work, we're just like, hey guys, go ahead and start working from home. And now all of our staff is working at home, and I'm the only one in the office these days. So I think to some extent that's been a comfort to folks, because they just know that we're continuing to do the business of city government and the work of our citizens. And so this is when our citizens need us right now, is to continue the operation, and the emergency response is just an added responsibility to what we already have.
Thanks so much, Joel. And actually, it's been mentioned a couple of times, video conferencing. We talked about it with the bid opening. We're gonna do a quick poll here, mainly to see where everyone is at in terms of what platforms they're using, and as well to share the information with others on the call today to show what other people are using to make these meetings virtual. So I'm gonna launch the poll here very quickly. And again, it's very focused on the video conferencing application that your organization has adopted, again, with the aim of sharing that data with everyone on the call today. So we'll give maybe a quick, again, 10-15 seconds for people to respond before moving on here. And I will say, like, today we're using GoToWebinar, but we've been using Zoom for maybe 3-4 years now. So that's kind of the platform of choice for us. You know, there were some security vulnerabilities that people had pointed out to, but those were mainly for the free editions of Zoom. And there's certainly measures that we have taken at Bonfire to secure that a little bit more with meeting passwords. That's something that I can share that we have done. In the meantime, let me show you what others are using. And if you, by the way, if you see other, you can comment in the questions and tell us exactly what you're using, and we'll be sharing that information as well. Okay, so the results. Just like at Bonfire, the majority are using Zoom, followed by other. And so I'll look at the questions here to see what others have been using. Microsoft Teams and Skype seem to be the others, but there's 0% who are not using any. And I know Paul's team uses Microsoft Teams as well, and they intend on using that going forward. Yeah, that's really helpful for us, and hopefully for everybody on the call today, just to kind of get a sense for what others are using. Okay, so now we're going to switch gears, and I'm gonna skip through. These are questions that we just asked earlier, and now we're going to be focused on the vendors. And we'll start with this question. We'll direct it to Paul. Paul, how can procurement teams help local businesses in these times? You know, are you maintaining work on projects that are typically carried out by local suppliers or contractors? Specifically now that we know a lot of people, you know, are losing business and losing their jobs, but in the meantime, there's probably things that can be done at the county, again, utilizing local businesses. Do you have any commentary on that?
Sure. I mean, certainly in terms of construction and public works projects, you know, majority of the times there are more local vendors, and certainly we kept those projects going as long as we could until, you know, our governor put a halt to all major construction projects because of the virus. So, we try to keep them going as much as possible. What I found to be very helpful is not to count out the little guy. Although we have, when it came to medical supplies, we had, relationships with all the major medical supply distributors because the county formerly operated a hospital. So we had those things in place, but they were experiencing, supply shortages and allocations and so forth of product. And we were able to find some local vendors, one a dental supply vendor that had a lot of excess industry because a lot of excess inventory because dentists are not permitted to practice in New York currently. And so we were able to buy gloves, masks, a lot of PPE supplies from this local supplier that maybe we did, maybe $10,000 worth of business a year with in the past. And, we've done well over $100,000 worth of business with them in about five weeks. So, don't count the little guys out and always keep an eye out on who those small businesses are right around you, because they're the ones that may be able to help you out in this type of crisis.
Thank you, Paul. That's actually a great tip. I wouldn't have tied it myself together in terms of the lack of people supplying doctors who can't operate now and being able to utilize that supply elsewhere. The next question is directed towards Jay and Joel, and we'll start with maybe Jay on this one. Are many of your vendors in affected regions, and how have you started to diversify your supplier base or plan to in this time?
As I said earlier, when the pandemic came upon us, all the gloves were off. We needed to find equipment and supplies. And what we found, just going back to the overbed table scenario again, Paul's completely right. The big producers, everybody went there from a provincial standpoint and ordered 5,000 of them, and they were gone. And what we found is using Google and our connections in hospitals and items like that, our entire team spent 3 days trying to find 24 overbed tables for an immediate need. And we finally found them, and it came from a small little supplier who was sitting in our own city. And that was pretty amazing. But by going through that process, we also made a lot of new contacts where those vendors who didn't have any, and this was quite amazing, vendors who didn't have any were more than willing to give us a lead as to who might. And following those leads, we were able to create an entire list of people who sold or may be able to distribute overbed tables. And that was great. We kept a list, we kept it in Bonfire, and we gave access to all of our 400 plus hospitals, direct access to all of this information that we always garnered on all of this equipment. And then as things came through, they got updated, and we were up to date all the time. And then about 2 weeks later, on the Easter holiday, we got a call, and we got an email from somebody who isn't even in healthcare. It was from a city. And they said, we have an emergency in our long-term care facility, and we too need 20 plus overbed tables immediately. Well, instead of spending 3 days, we were able to resolve their issue in less than 2 hours, because we were now starting to get vendor information that says, look, if we got another 250 coming in on this date, the following week we're going to have another 150 coming in. And because we had that information, we were able to resolve that immediate issue. And it was that kind of communication and interaction with the vendors that actually allows us to keep all of our information up to date, and the hospitals to be able to go and just, all right, now I have the latest and greatest information associated with this. And also, we would also in turn continue on with the making contact with them and making sure our notes were up to date, and people just had to utilize them instead of reinventing the wheels, of which for overbed tables, we as a team spent 3 days garnering.
Thanks, Jay. Joel, anything to add on whether vendors were in the affected regions that you've had before and how you were able to diversify the supplier base?
Yeah, so similar to Jay, I would say that our vendors, yes, they were affected regions, maybe not geographic, but the ones that you usually go to for supply, they're completely out. So, you have to turn to others and be a little bit more creative. You know, in terms of diversifying the supplier base, we found through this emergency, we've been able to bring on new vendors that we haven't dealt with before. And we may have, our process may have, our formal procurement processes may have scared them away from doing business with us in the past, but through this, we've been bringing on new vendors. And our local economy, everybody's local economy is just hurting so much. So the restaurant and hospitality businesses are hurting. So through this emergency, we're turning to them to help supply part of the response to the emergency, feeding local seniors who can't get out of their homes. So we're turning to local caterers to help with that. A program to help for first responders who are healthy but can't return back to their homes for fear of infecting them. So we're tapping into the local hospitality sector, the hotels, to help implement those programs. We're also like providing face covers for all 5,500 Louisville Metro employees, and we had those custom made from a sewing shop in Central Kentucky. So we're helping continue to stimulate the local economy through this emergency and the pandemic. We also have a list of minority and women-owned businesses that we've, as part of the incident management team, we also look through an equity lens. So how are we equitably responding to this so we don't have disparate outcomes? And so that list of vendors are made available to those who are making purchases as well, to encourage the utilization of those who have been certified minority and women-owned businesses here locally as well.
Thanks, Joel. These are some great ideas, and we've talked quite a bit today on, you know, whether it's coming up with innovative solutions like having caterers, you know, deliver meals to seniors or those who are under quarantine. The mask story was really good as well, and I think that points to a general sense that we're seeing. And I'm going to be actually launching a poll at the same time that I'm going to be asking the panelists to talk about this. And this is a question directed to everybody on the call today. Do you think some of the process changes, attitude shifts, you know, creative solutions that we have kind of stumbled upon now and that we've discussed earlier on their call are here to stay post-COVID? You know, we've talked about potentially doctors not flying to Europe to physically inspect $1 million machine or doing site visits. Are these things here to stay, or are they just a function of the times that we're in? So again, I'll launch the poll for the attendees today. In the meantime, we'll get the panelists to weigh in, starting with Jay.
So all of the indications coming back right now is that we're going to make it through COVID-19 this round, but it's going to be with us till 2020, till somebody comes up with a vaccine. I think we would be remiss to think that once this ends, maybe in June or July, that's the end of that. And part of that thinking is based around what happened with SARS, where it just up and disappeared and didn't come back. And for those of you who were around 18 years ago, you relive this exact same scenario. So looking at it going forward, that we need to be ready for COVID coming back or the next pandemic that's going to arrive, given the status of our world right now. I think we're going to see more preparation in regards to working from home. For us, because of Bonfire, because of all of the other tools that we utilize, as others have said, we decided on a Monday at 10 o'clock that people need to work from home, and by 1 o'clock people were home working. We're down to, you know, I need to make sure that people have printers and scanners at home, and that will pretty much round out their needs as far as what might be missing at this point in time. The pre-bidder conferences will continue the way they are, but this virtual vendor site, I can perceive that as being implemented, hopefully, as part of our new process. because it not only saves time, but if you put into perspective the amount of cost to have employees leaving for 3 or 4 days, going to other countries, the costs of losing positions doing their roles, and the cost to the vendor to have you come, to pay for hotels and do all of that, this is another significant savings once people become comfortable with it. Our preference will always be that if it's in the neighborhood and close, you can actually go touch and see. But I think the offset and the payback based on the success so far, and hopefully that will continue, that will be something that we really want to look at next. I think it's just a general move forward in that regard. Virtual negotiations, I think, will expand for us, not only on the regular piece of equipment, but on those more high techs. I think we're ready to do that. I think the hospitals and the vendor community, based on our historical reactions, will be even more accepting of this. We just need to dot a few more I's, cross a few more T's, and make sure that prior to the negotiation, all of the preparation has been done.
Thanks, Jay. We'll go with Travis next.
Yeah, I think some of these things that we're implementing now, especially the virtual work, will continue on. I agree with Jay. We're not, you know, we want to go back to campus. We want to be there. We love being with our students, but our faculty and staff, we realize that maybe more of them can work remotely. That is something that I think is going to stay. It's changing people's minds at the moment. People can still be productive, but not actually be physically at the office. I think we're going to, from an academic perspective, the marketplace wants online education. We're probably going to have more offerings of that or more hybrid type things. You know, we've tried in our office. Our whole staff is remote as well, much like Jay, except we're just remote on our campus, so we can go walk to each other if we want to, but we've been doing more of that for the last couple of years. I think more of our staff will engage that as well, which will save us time, which will save us resources, and I think that our executives are realizing the benefits of this, and as we deal with potential budget challenges, which the university and all higher education have, this is a good way for us to take a look at our processes, consolidate those processes amongst departments, and that's going to hold for the next few years.
Thank you, Travis. Paul?
Yes, I think that a lot of the new technologies that we're utilizing now are going to continue. Certainly, we're going to continue using Bonfire to get to the point where, you know, all the solicitations are done electronically. You know, we're probably about 90% there currently. I think the use of virtual meetings is going to really continue, both internally within the organization as well as externally. We found there was a savings internally in terms of time as well. Our county government has 2 main campuses, about 10, 15 minutes apart. And when you have to drive back and forth 3 times in a day for different meetings, you know, you're wasting an hour of your day just driving back and forth between the 2 campuses. So I think this crisis has pushed the use of the virtual tools that are out there, and I think that's definitely going to continue going forward.
Thank you. And finishing off with Joel.
So my simple answer is yes. Some of these will be maintained. Attitudes, our attitude shifts. I think it's forced us to embrace technology. Those that are a little bit harder to bring along are forced to come along. However, you know, there are laws that were set up, that were highly regulated. So there are laws that were created that haven't adapted to modern technology, that I hope we can get some laws changed to help facilitate better ease of procurements without sacrificing equitability, transparency, and fairness. But in some ways, I hope some of this doesn't stick around. Because at the end of the day, we're talking about people and people's decision-making abilities and connecting with people. And I think while technology is great to help facilitate work getting done, I hope we don't lose the connectivity, the one-to-one relationship with people. And that's something that I don't know that technology can help with.
Thank you, everyone. And so it seems like there's consensus, even I'll say at Bonfire right now, we're beginning to think about, well, we've been operating, as a 100-person company completely working from home. And so far it's been going very well with us. And it's having us kind of question our own kind of beliefs before COVID and after COVID. But I do agree with you, Joel. There's no, technology doesn't replace human-to-human contact. For those on the call, I know we're just at time here. I know that many are probably systemless right now, and you're forced to be working from home. So I want to highlight our emergency response program, in which we're giving away Bonfire for free to use until July 31st, just to kind of get you over, hopefully, that time in which you're kind of forced to work from home. We've had literally tens of organizations sign up already, particularly from hard-hit states, and this is a simple way in which we can help. Leverage technology to help you and help your citizens. I want to thank the panelists today for joining us, for contributing your knowledge and ideas with everyone. I know it was very well received by the attendees. I hope everybody got to learn a little bit more about how to handle the situation, and I hope for everybody to be safe in the months to come. Thank you again, and hope to connect with all of you soon.
Thank you.
Thank you.
All right, thank you.
Thank you.